Welcome to Clinical Nurse Leader Exam. Let's begin. Question 1. Which of the following is the first step in the basic life support (BLS) sequence for an unresponsive adult? Here are your options. Option A. Check for a pulse. Option B. Open the airway. Option C. Ensure scene safety. Option D. Begin chest compressions. The correct answer is option C. Ensure scene safety. Explanation. Before initiating any patient care, the rescuer must verify that the scene is safe to avoid becoming a victim themselves. Question 2. What is the normal resting heart rate for a healthy adult? Here are your options. Option A. 40 to 60 bpm. Option B. 60 to 100 bpm. Option C. 100 to 120 bpm. Option D. 120 to 140 bpm. The correct answer is option B. 60 to 100 bpm. Explanation. A normal resting heart rate for adults ranges from 60 to 100 beats per minute. Bradycardia is below 60, and tachycardia is above 100. Question 3. When administering medication, which of the following represents the 6 rights of medication administration? Here are your options. Option A. Right patient, right medication, right dose, right route, right time, right documentation. Option B. Right patient, right bed, right medication, right dose, right route, right time. Option C. Right nurse, right patient, right medication, right cost, right route, right time. Option D. Right patient, right diagnosis, right medication, right dose, right route, right time. The correct answer is option A. Right patient, right medication, right dose, right route, right time, right documentation. Explanation. The 6 rights are critical safeguards against medication errors, ensuring the correct patient receives the exact prescribed treatment at the right time. Question 4. A patient with increased intracranial pressure, ICP, should ideally be positioned in which way? Here are your options. Option A. Trendelenburg position. Option B. Supine with the head flat. Option C. Head of bed elevated 30 to 45 degrees. Option D. Prone position. The correct answer is option C. Head of bed elevated 30 to 45 degrees. Explanation. Elevating the head of the bed 30 to 45 degrees promotes venous drainage from the head, helping to reduce intracranial pressure. Question 5. Which personal protective equipment, PPE, should be removed first after caring for a patient on contact precautions? Here are your options. Option A. Goggles. Option B. Gloves. Option C. Gown. Option D. Mask. The correct answer is option B. Gloves. Explanation. Gloves are generally considered the most contaminated piece of PPE and should be removed first, followed by hand hygiene before removing other PPE. Question 6. What is the primary action of an ACE inhibitor, example, lisinopril? Here are your options. Option A. Slows heart rate. Option B. Promotes fluid retention. Option C. Blocks the conversion of angiotensin I to angiotensin II. Option D. Increases cardiac contractility. The correct answer is option C. Blocks the conversion of angiotensin I to angiotensin II. Explanation. ACE inhibitors block the angiotensin converting enzyme, preventing the formation of angiotensin II, a potent vasoconstrictor, thus lowering blood pressure. Question 7. Which laboratory value is most important to monitor in a patient receiving intravenous heparin? Here are your options. Option A. Point or INR. Option B. EPTT. Option C. Platelet count. Option D. WBC count. The correct answer is option B, APTT. Explanation. Activated partial thromboplastin time, APTT, is the specific lab value used to titrate and monitor the therapeutic effect of continuous intravenous heparin. Question 8. A patient in diabetic ketoacidosis, DKA, is most likely to exhibit which respiratory pattern? Here are your options. Option A. Cheyne-Stokes respirations. Option B. Kussmaul respirations. Option C. Biot's respirations. Option D. Hypoventilation. The correct answer is option B. Kussmaul respirations. Explanation. Small respirations are deep, rapid breaths that occur as the body attempts to blow off excess carbon dioxide to compensate for metabolic acidosis. Question 9. Which of the following is a classic sign of deep vein thrombosis, DVT? Here are your options. Option A. Bilateral lower extremity edema. Option B. Unilateral leg pain, swelling, and erythema. Option C. Cool, pale, and pulseless extremity. Option D. Numbness and tingling in the toes. The correct answer is option B. Unilateral leg pain, swelling, and erythema. Explanation. Unilateral swelling, localized pain, redness, and warmth are classic clinical manifestations of a deep vein thrombosis in the lower extremity. Question 10. The nurse understands that a patient with a sodium level of 120 milliequivalent or L is at highest risk for. Here are your options. Option A. Cardiac dysrhythmias. Option B. Seizures. Option C. Muscle cramps. Option D. Hypertension. The correct answer is option B. Seizures. Explanation. Severe hyponatremia, normal 135 to 145 milliequivalent or L, can cause cerebral edema, leading to neurologic symptoms such as confusion, lethargy, and seizures. Question 11. Which gauge needle is typically preferred for administering packed red blood cells to an adult? Here are your options. Option A. 24 gauge. Option B. 22 gauge. Option C. 18 gauge. Option D. 26 gauge. The correct answer is option C. 18 gauge. Explanation. An 18 gauge to 20 gauge 4 catheter is preferred for administering blood products to prevent hemolysis of red blood cells during infusion. Question 12. What is the most common cause of healthcare-associated infections, HICE? Here are your options. Option A. Airborne transmission of pathogens. Option B. Improper hand hygiene by healthcare workers. Option C. Contaminated surgical instruments. Option D. Contaminated hospital food. The correct answer is option B. Improper hand hygiene by healthcare workers. Explanation. Failure of healthcare personnel to perform proper hand hygiene is the leading cause of transmission of healthcare-associated pathogens. Question 13. Which assessment finding indicates a potential complication after a thyroidectomy? Here are your options. Option A. Hoarseness of voice. Option B. Tachycardia. Option C. Positive Trousseau's sign. Option D. Elevated blood glucose. The correct answer is option C. Positive Trousseau's sign. Explanation. A positive Trousseau's sign indicates hypocalcemia, a potential complication of thyroidectomy due to inadvertent damage or removal of the parathyroid glands. Question 14. A patient with chronic obstructive pulmonary disease, COPD, typically has a respiratory drive triggered by. Here are your options. Option A. High oxygen levels. Option B. High carbon dioxide levels. Option C. Low oxygen levels. Option D. Low carbon dioxide levels. The correct answer is option C. Low oxygen levels. Explanation. Unlike healthy individuals whose respiratory drive is triggered by hypercapnia, HyCO2, COPD patients develop a hypoxic drive, triggered by low oxygen, hypoxia. Question 15. Which medication is the first-line treatment for anaphylactic shock? Here are your options. Option A. Intravenous diphenhydramine. Option B. Subcutaneous epinephrine. Option C. Intramuscular epinephrine. Option D. Intravenous hydrocortisone. The correct answer is option C. Intramuscular epinephrine. Explanation. Intramuscular epinephrine, usually via autoinjector to the outer thigh, is the immediate, first-line treatment for reversing anaphylaxis. Question 16. What is the primary purpose of an incentive spirometer? Here are your options. Option A. To measure lung capacity. Option B. To deliver inhaled bronchodilators. Option C. To prevent atelectasis and pneumonia. Option D. To monitor peak expiratory flow rate. The correct answer is option C. To prevent atelectasis and pneumonia. Explanation. An incentive spirometer encourages deep breathing, which helps expand the alveoli and prevents atelectasis, lung collapse, and pneumonia postoperatively. Question 17. When assessing a patient with a suspected stroke, the acronym FAST stands for. Here are your options. Option A: face, arms, speech, time. Option B: fever, airway, sensation, temperature. Option C: face, airway, swallowing, time. Option D: fainting, arms, strength, transport. The correct answer is option A: face, arms, speech, time. Explanation: FAST is a rapid assessment tool for stroke, face drooping, arm weakness, speech difficulty, and time to call emergency services. Question 18. Which of the following vital signs represents a late sign of shock? Here are your options. Option A: tachycardia. Option B: tachypnea. Option C: hypotension. Option D: restlessness. The correct answer is option C: hypotension. Explanation: hypotension is typically a late sign of shock. The body initially compensates by increasing the heart rate, tachycardia, and respiratory rate, tachypnea. Question 19. A patient receiving a blood transfusion develops a sudden fever, chills, and lower back pain. What is the priority nursing action? Here are your options. Option A: administer acetaminophen. Option B: slow the transfusion rate. Option C: stop the transfusion immediately. Option D: notify the physician. The correct answer is option C: stop the transfusion immediately. Explanation: these are signs of an acute hemolytic transfusion reaction. The absolute priority is to stop the transfusion immediately to prevent further harm. Question 20. Which anatomical structure is responsible for preventing food from entering the trachea during swallowing? Here are your options. Option A: esophagus. Option B: epiglottis. Option C: larynx. Option D: pharynx. The correct answer is option B: epiglottis. Explanation: the epiglottis is a flap of cartilage that covers the trachea during swallowing, directing food and liquids into the esophagus.